Are you someone that experiences hip tension, lower back tension, or is very active in terms of your everyday living? My name is Zack from MyLab, and I'm going to show you the best ways to use the lacrosse ball to roll out your hips, okay? So first we're going to start off with our glutes, the bigger muscles in our hips, primarily used for extension and a lot of rotation internally and externally. So the best way we're going to do this, we're going to take the ball, we're going to lay it onto the ground.
Right.
We're going to ease into the glute by sitting on it. So it's important to relax into this. If we're too tense, we're not going to feel the release that we need. We can increase some intensity by putting our foot up onto our other knee and finding that spot that's more intense than the rest. Holding it for 3 to 5 minutes or until the pain reduces by half. I can move my leg or my hip side to side to increase that intensity. Secondly, what we're going to do, we're going to be rolling out what we call our quad muscles. So you have 4 different ones. Your lateral quad, so the outside of your leg, is going to be very, very intense for you. Your rectus femoris is going to be the one we primarily want to target here. So we're going to take the ball, we're going to lay it onto the ground. Now the muscle groups we're going to be targeting is for the anterior portion of our leg or our thigh. We're going to get down into a planked position. Same thing here. We're going to find a tender spot. You're going to want to hold it for 3 to 5 minutes or until the pain reduces by half. We can bend our knee to increase the intensity. Ideally, this is done on a hard surface and you're working from the hip all the way down to the knee. Thirdly, we have our muscle called our TFL or tensor fasciae latae. So this muscle is a combination with the glute and the TFL. It makes up the IT band. Stop rolling your IT band. You're not going to change how the muscle tissue is, but primarily your TFL is going to be something that affects that. So your TFL is going to sit right here in your pocket. If you're wearing jeans, right in the pocket area. Best way to roll it out, take a ball, place it onto the ground, find that area, and ease into that. I can rotate my hips side to side as I look for a more tender spot. Once I find the spot, holding it for 3 to 5 minutes or until the pain reduces by half. Very commonly, you may feel some tension, nummy, achy feeling down your leg. That's completely normal. That's where you're on the muscle knot itself. Now, fourthly, what we want to try to get at is our diaphragm. You're probably wondering why. Well, our hip flexors attach in around the diaphragm. Now, our diaphragm's a U-shaped muscle that comes down around the side here. So it's very important with this one that we stay relaxed as possible. We don't put the ball onto our rib cage to avoid any fractures, but making sure we're getting in underneath the rib cage itself. So we're going to take the ball, we're going to lay it onto the ground. We're going to ease into this one. Take your time with this one. Finding that spot, relaxing into it. Now it's important with this exercise, once we get relaxed, we take some deep breaths, going in and out. Same rules apply. Hold this for 3 to 5 minutes or until the pain reduces by half. Now, rolling out these areas are going to be a great way to maintain any sort of hip mobility, lower back discomfort, or overall postural tension in the lower half. Thank you for watching.